the Vodafone Connected Health Ambassador for 2 years. We're working on what our policies are going to be in healthcare going forward. As you might have seen recently, we announced our partnership with Deloitte, trying to create some kind of Europe-wide consensus on policy in healthcare. And you'll be hearing more about that over the next year or so. But 5G healthcare, connected healthcare, it all makes sense. Remote monitoring, remote sensors, whatever, it has to be connected. And I love the fact that industry now are playing a huge role in our healthcare system as equal partners. So Amy Cameron's going to take us through the whole of 5G in healthcare. So I'm really excited. Thank you, Amy.
Hello. Great. Thanks very much for having us. So I realize we're running a little bit behind schedule, so we'll try and make that up as best we can, but we don't want to rush too much through our content. And as Shafi says, we're thinking about what is the role of telecoms operators in all of this digital health stuff that we're hearing about at the conference, which has been really exciting. So I'm going to kick off just by letting you know what the agenda for this morning is. So quick intro from me, and then we're going to hear some great speakers from Telia in Sweden and how they're using telecom data to combat COVID. Then we're going to hear from Sultan Mahmood, who's director of BT Health, and find out what BT is doing. Then we're going to hear from the VP of Health at KPN, which is the Dutch incumbent operator, and they've been invested in the healthcare industry for, I think it's coming up 10 years now, and we're going to hear about some of their work. We're going to have a panel discussion with all those folks, and then after that, my colleague Darius is going to run an interview with Vodafone and Deloitte, specifically on what Shafi was just telling us about, so you'll get some more detail on that very soon. So the point that I want to start with is some of you guys might be thinking, okay, really, what is the role for telecoms operators here? And what I want you to take home is that, yes, telecoms operators can do connectivity, but there is a much bigger role for them in healthcare if they are committed and if they have the vision. So yes, the connectivity, all the mobile, the fixed, the security, IoT, that's evident to everybody. The next layer up, in terms of application enablement, is one that we're looking at that telecoms are playing, and that's really revolves primarily around secure messaging, but there's a lot more there in terms of security, in terms of APIs, cloud, identity, authentication. And then the last layer up, or last two layers, I mean, medical services, not many telcos are playing there, surprise, surprise, but in the solutions and applications, and how can they work together with the industry to deliver something end-to-end, really challenge some of those implementation challenges, and how can they bring to bear more than just their connectivity assets, but their relationships with government, their relationships with healthcare providers, their relationships with consumers, their capital. They have money to invest, and if they choose to invest it in healthcare, they can make a big difference there. And there are many telcos that are doing a lot here. So on the left-hand side, we have some operators that have been playing in the healthcare industry for a long time and play across the board. And also today, we're going to hear from BT and Vodafone, who primarily play in the connectivity space, but are making investments now really to build up and do more. And so really looking forward to hearing what they're doing there. Why are telcos interested in this now? And look, they are interested because they know they have a role to play, and there's a lot going on in the telecoms industry that is driving telecoms operators to think outside their core connectivity business and what can they do for enterprises and consumers beyond connectivity. But it is also because of the acceleration that COVID is driving. This is the opportunity. We've seen accelerated uptake of digital health throughout the pandemic. And we did some research ourselves at STL Partners on this and found that really across the application areas that are most relevant to telecoms operators, this number is not the whole of the UK healthcare industry. It is across the applications that we looked at that are relevant to telecoms operators. It has accelerated the market by 4 years. And the difference between the pink bar and the blue bar is really the accelerated potential cost savings that higher adoption of digital health is delivering to healthcare providers, or could deliver to healthcare providers. If we break that down into, what can telecoms operators do within this? We're looking at 4 main application areas where telecoms operators can build on top of their connectivity. So virtual care and telemedicine, that's the main space they're playing. Remote monitoring, obviously hugely dependent on connectivity and a very difficult integration challenge, both within the patient user and the clinical user and the connectivity and making everything work end to end. diagnostics and triage, which is kind of linked up to all of those things, maybe not such a direct opportunity for telecoms operators, and data analytics, which we're going to hear about very shortly from Telia. And just to give you the breakdown in terms of the UK, what this looks like, diagnostics and triage is really where there is the biggest opportunity to save costs for the healthcare industry, making sure that patients are getting the right care in the right place, getting diagnosed quickly, leveraging more advanced AI and connectivity tools, but obviously remote monitoring, virtual care, and increasingly towards the end of our forecast period, data and analytics will play a bigger role. So that's a real snapshot of what STL Partners is looking at in terms of the role for telecoms and health. But without further ado, I would like to introduce our first speakers from the telecoms operators. So this will be Jørgen Gustafsson, who is head of AI research at Ericsson, and Christopher Agren, who is head of data insights at Telia's Division X. And they will share with us what they've been doing in Sweden. So thank you very much, and a warm welcome to our speakers.
Thank you so much, and thanks for having us. So Jørgen, if you will share the slides, please, then we can get started. So during the early COVID-19 pandemic in Sweden, hospitals and healthcare resources were stretched thin, and the spread of the virus varied heavily and was not really easily predictable. And you see it in the diagram to the right here, the number of hospitalized patients and the number of admitted patients to the ICU. So the hospitals needed something new, a new method of accurately forecasting in this new fast-changing environment. New data sources and new forecasting models were needed. So in late spring of 2020, a new collaboration was started. It was a multiple business to government collaboration, and on the business side, it was us, Telia, the largest telecom operator in the Nordics, Ericsson, a global leader in telecoms technology, and we engaged with one of the largest hospitals in Sweden, Sahlgrenska University Hospital in Gothenburg. We all wanted to help, and so we actually started this up as a pro bono collaboration. And the idea we had came from the very basic concept that the virus, of course, spreads through human contact. So data on people mobility that telecoms can provide should be useful here. We had the hypothesis that by using anonymous and aggregated telecom mobility data and advanced AI models, we would be able to predict the number of admitted COVID patients for the next upcoming weeks. This was a formidable challenge, both in terms of data analytics, but also on a quite large B2G collaboration. But as you will hear, we were able to achieve what we had hoped, and the new forecasting model was in fact implemented and used for real forecasting in real hospital settings. Next slide, please. So the data used for this comes from the Telia existing products called Telia Crowd Insights. These are products that use anonymous and aggregated signaling data from our network. It's over 1 billion data points each day. And this data set allows us to anonymously provide insights on the mobility of the full population of a country. For example, in this screen here, you can see Finland, a visualization of all the trips made in Finland a particular day. Since we own our own mobile networks and we control the full process from anonymous data to actionable insights, this data comes with our assurance that it is reliable, holistic, and continuous. We've also developed our statistical models together with the Swedish Bureau of Statistics, and they actually conclude that our data is good enough for official statistics. Typical customers and use cases involve urban development, tourism analysis, public transportation optimization, carbon emission modeling, etc. And having this high quality data, GDPR secured, already available, was one of the key factors in being able to quickly set up this collaboration. Over to you, Jørgen.
Thank you, Christopher. So what did we do? Well, the main outcome was represented in this chart, is to predict the number of admitted patients for a couple of hospitals in the western part of Sweden. And the chart is showing, the black curve is showing the actual admitted patients, and the purple curve is showing the forecasted patients, where we look 3 weeks into the future. And as you can, just by visually looking at the curve, you can see that we actually did pretty well in predicting number of patients. So how did we do this? Well, we used historically admitted COVID-19 patients because, of course, if we had no pandemic, then it doesn't matter how we would behave and what could be sort of captured in the mobile network. So, of course, it's important the state of the pandemic, and that's connected in this historical admitted COVID-19 patients. And then mobile network data, but it's not that simple to just push the data into something and then you get out the result. So we did quite advanced and AI-based selection of a subset of the mobile network data available. And then after a while, we also started using vaccination statistics because obviously vaccination rate impacts the spread of the virus and how many people are hospitalized. And then a key thing was to use advanced artificial intelligence because, like I said, it's not just an easy task to take this all data and get a curve and some accuracy like we see in the chart. So that led to a forecast we calculated 2 to 3 weeks into the future, which was really great for the hospital because they didn't have any other prediction means to go this far into the future. And just to give sort of a numerical value of the performance is that in 11 out of 16 weeks, the error was less than 30%. And we were also able to detect trend changes, which is even more important for the hospital. So then going to our slide is how it was used and success factors. And you can see the quote here from the Chief Medical Officer at Sahlgrenska University Hospital, Thomas Brescica. The collaboration has enabled the development of a reliable tool for short-term prediction of admissions to the hospital due to COVID-19 and has been vital for our planning and effective resource allocation to ensure that all patients receive the care needed. So it was really important for the need of the hospitals in a crisis situation. So then to conclude, the three main success factors, we call it our triple helix, and it's not a true one because it's telecom, it's industry and government, healthcare, but it was really key to be Telia provided the data and had the infrastructure and knowledge and the experience from you working with the data. Ericsson provided the AI competence, and of course the healthcare and the hospital in itself because they have the needs. And then the data, like Christopher said, without the data it wouldn't work, of course, and it was an important aspect to have it irreversibly anonymized and aggregated to avoid any privacy and GDPR issues. And then finally, like I said before, that we used advanced AI, otherwise it wouldn't have worked. To just take the data and look at it, it wouldn't have helped. Then it's just a mess. So we needed that to squeeze out this information. So with that, we conclude our short presentation, and we don't want to take more time than needed since we're running a bit late, but I hope we have time for a few questions now.
Wonderful. Thank you so much, Christopher and Jürgen. And I'm sure we'll have some questions for you during the panel session afterwards, which will open up to the audience as well. So do think of your questions. Next up, I would like to invite Professor Sultan Mahmood, who's going to tell us about BT Health Inside Out. Do you have a mic? I'll give you this one.
Good morning. How are you all today? How's the energy? Dear Lord, not as good as last week's audience. Listen, I'm going to start with a few questions. Can you tell me the percentage of doctors who perform tasks for which they are overtrained? This is 76%. Percentage of nurses? 78%. Okay. Can you tell me how many people that go into an average A&E department walk back out within a few hours when they're entering the scene? 4 out of 5 walk back out. Okay. Final question. I need to do this pop quiz just to get myself going. Final question. How many clinical systems do you think there are in an average UK hospital? Not bad, not bad. Any more? Higher. The average in the UK is 189. Okay, so that just sets the scene of some of the stuff I'm going to talk about. But let's get started. So Amy asked me to talk about my inside-out experience. So I've come from the NHS, 22 and a half years, and the gentleman here on my left, Professor Shafi Ahmed, was the one who prompted me to kind of do something different. So if it all goes belly up at BT, he's to blame. And who does he work for? Oh my God. I've been led up the garden path. Okay, look, purpose, yeah? I joined BT because I really believed in Philip Janssen's vision around connecting for good, for standing up for the country, doing something more than BT has done so over the last few years. So purpose is really important. And the purpose of today, for me, really, is to talk about my onboarding experience, some of the kind of early thinking. I'm not going to go through the strategy, surprise, surprise, but I will do that at a later date. Today's the first part of a trilogy of talks, and sometimes the sequel's better than the original. This is that kind of time, okay? Okay, so who am I? So this is me, 22 years in the NHS. I've worked across the spectrum, really, in primary, secondary, community care. Did some very interesting work around integrated care and kind of reimagining GP services, which at the time, the Department of Health and Social Care has told me that I'd need primary legislation. I didn't, and we got it done. We increased non-elective admissions by 8%. We increased the percentage of people being seen within 24 hours by 83%. The experience of delivering care for those GPs managed by an acute provider, if you like, was significantly better. So I did some really interesting things. And I've had the privilege of leading the largest R&D function in the country as part of the NIHR, the largest network consisting of 23 trusts. I've had a specialism in digital data. I'm a trained analyst. That's where I started. Population health. I was the first person to embed a population health service into a large acute provider. Okay, and new care models we've talked about. So interesting career. And I suppose the interplay between academia, research, innovation, and digital, and the power to for all that to kind of come together under an organization, BT was the natural fit. And there's some various other things there that I'm part of. Okay. So what's BT up to? So this is some of the stuff I was pleasantly surprised as I joined. We have our 80-acre site in Adastral Park, one of the largest digital health hubs in Europe, consisting of 100 companies on site and formal academic links with 40 universities. Why is that important? If you think about the academic output of a country, in this country, it's about 75% still come from doctors and nurses. Yeah. So if we're going to do something, Amy's statement was contingent on, are telcos willing to do more than they are now? Are they really committed? Well, this demonstrates some of our commitment. 2.5 billion invested in R&D over the last 5 years. As you know, we stood up the Nightingale hospitals, the infrastructure for very, very quickly, and 200 odd vaccination centres. The Lifelines programme, which we are really proud of, has impacted on 1,400 families whose relatives either worked in a critical care environment or were patients in there. Straight out of the box solution that really connected them, and we've won awards for that. And again, we took, we take 30 million calls per annum as part of the emerging services network. 105,000 calls during the peak of the COVID-19. So we're part of the health service. We're a kind of trusted partner, but there's a lot more to do. And the way to do it, according to me, is the co-creation. I totted up about 1.5 billion I've bought from the commercial sector in my time in the NHS. And the common factor was the people who understood us really carefully, spent time with us, co-created with us, tended to do better and tended to get the deals. And I'm going to talk a bit about three things now. So I work with University Hospital Birmingham Foundation Trust. They're one of 8 Vanguard sites that we have that we're developing really interesting propositions around across the spectrum of care, from anticipatory care and remote monitoring to population health. Belfast Harbour, so this is the adjacency play. So complex problem, too many ships coming into an old infrastructure, queuing issue, sound familiar, A&E, elective medicine, non-elective medicine. overlaying kind of real-time network data and AI, powerful AI, into managing that harbour is phenomenal. If you ever have time to read the case study or look at the video, please do so. And again, great work at the University of Warwick around a kind of 5G connected campus. But we're talking about health today. So I want to show you a very short video around kind of the experiences at working with UHB. And hopefully that will tell the story probably better than I can.
Activated.
One of the main things you do as a paramedic is go to environments that we can't control. There's always a sense of interpretation as you approach. If we can get on top of things faster, that is going to save some lives.
"5G is a cutting-edge technology. It's mainly focused on mobile, and it's got three major characteristics: speeds above 1 gigabit per second, massive connectivity, and the third one is low latency. In healthcare, we can imagine live transmission and sharing across two different locations between a clinician and a medic.
5G to us in healthcare is much more than just a faster 4G. It allows us for the first time to use high-definition video to transmit images of patients, images of their conditions, and also we can use it to transmit high-definition images of an ultrasound.
It's amazing how people started working together, and in a couple of months, we had the first ultrasound test that we did over 5G. We have now, a connected ambulance and capability to do a real-time diagnosis.
I place the haptic glove on my hand. I do my ultrasound as I would anyway. Doc, I'm wondering if I could run something by you for a minute. The physician moves the joystick left, it will vibrate, and I'll move my hand left. At the ambulance, we also have a 180-degree camera. Using the virtual reality headset, the doctor back in the hospital can see a view of the back of the ambulance. That's directly linked to the ultrasound and the vital statistics. Using the augmented reality headset, I can show them what I'm actually looking at. Zoom 2. It's all audio command, so I'm not even touching the headset. The 5G project is essentially like having an entire specialty suite within one environment. I can already phone them, but if we can get on top of things out in the community faster, it'll free up beds.
And in this particular case, in which the patient is bleeding into their tummy from their liver, allows us to make sure that they come to the right hospital at the right time, so if necessary, they can go straight into liver surgery.
It takes 15 years plus to train doctors to do some of the stuff we do here. The ability to increase the capacity of our workforce is limited by the length of time of their training. There's a huge area where technology can simply fill that gap.
I think it will be a game changer. I think it will be part of a process in which the NHS and other healthcare systems start to move into adopting new technology to improve the delivery of healthcare to very large numbers of patients.
5G opens a new culture of collaboration to transform these industries. It's not just to do it differently, but it's to provide more added value.
Without embracing technology, there is simply no way we're going to keep up with the demands being placed on the service.
Midwives, district nurses, pharmacists, they're all able to benefit from this 5G network, ultimately delivering better healthcare and making a big difference to more people's lives.
So the engagement with the companies delivering the connectivity is hugely important. It is the only reason that we've come as far as we have, both in terms of what we've already done, but certainly in terms of what the world could look like in a few years' time.
Using the 5G network of BT, we are transforming the way that healthcare is provided, and we want the Queen Elizabeth University Hospital of Birmingham to be the lighthouse for the UK and for the NHS.
So, really interesting work. So the co-creation piece, and this is the number of people and time we have spent with the clinicians at UHB. We're really getting to grips with the kind of operation issues. So the issue we have is there are 200,000 clinical startups or kind of health-related technology platforms, providers, applications globally. Yeah? The biggest challenge is what, do you think? Anybody, just shout out. What's the biggest challenge? Money is one. It's not the biggest challenge. It's not the biggest challenge. Coordination. That's a good one. Coordination. The biggest challenge is translation. So Professor Shafi talks about translational medicine a lot, but this is in very funny Midland speak. It's about stickability. So a chief executive can go out and buy a wonderful tool. If it doesn't translate into workflow changes for the clinicians and integration into the EPR and the EMR, it's a vanity project. Amy, you asked the question, what are we going to do at BT? what we're going to do is we're going to think about where the literature is, where the practical evidence is, and we're going to talk about translation. And all of our propositions that are coming up, part 2 of the sequel, not today, right, will deal with the issue of translational medicine. So 138 published peer-reviewed articles on digital innovation. They can be summarized into these 5 pillars, if you like. Number 1, digital innovation. Remote care, we've seen Telia colleagues already talk about that. One-to-many care. Why is that important? Who can tell me the percentage of vacancies within the NHS as of today? Julian, you know, you're usually good at this. 14% of the NHS workforce is vacant. 14%. So the days of one-to-one care, folks, are gone. The days of one-to-many care are gone, and that's where connectivity becomes really important. Amy's right, this is a really big growth area. And then there's the machine-first augmentation. What that means is if we create front doors, and we're working with 8 of our lighthouses around creating a digital front door where the patient is put into a lane right at the outset to avoid the queuing issue. Primary care transformation, 90% of care is delivered in primary care. This needs very much kind of looking at. So, you know, notwithstanding the recent stuff in the press, if you think about how doctors, particularly in kind of primary care land, stepped up during the pandemic, if they were supported with a full suite of technology, not point solutions, then there is a real chance of providing something we call in the business as anticipatory care, doing something before something goes wrong. Self-care transformation. So the days of the 50s and 60s where there were community assets have gone. Reductions progressively has led to people being really isolated, and technology perhaps has exacerbated that. But technology can actually help to kind of connect people together to manage self-care. We get into the business of wellness. Data-driven complex care. Well, this is really where the value chain, Amy, if you think about commitment, this is where telcos really need to think about. And by George, we are seriously thinking about that. And then the last bit around high reliability anchor organizations. So any of you who have read kind of some of Tim Ferriss's work, topical figure, will know about high reliability. Unwarranted clinical variation, unwarranted process variation within a healthcare setting is rife. How do you get to high reliability? Well, A, there's the data, B, there's the kind of translation, but B, it's kind of linking the investment in technology to outcomes. If I were to ask you, kind of generally telco folks, can you tell me the CQC pillars of regulation? Who can shout something out for me? Safe, effective, well-led, caring, responsive. If anything doesn't go back to those 5 key imperatives, then why are we all here? Why are we all pretending to talk about health? This is going up the value chain. So that's kind of the synthesis of the literature. What are we doing at BT? Well, for the first time in our history, I went in 5 months ago and made a list of demands. I'm really pleased to say Philip Jansen said yes to everything. So full actualized healthcare vertical, end-to-end, a whole new digital arm building out our propositions so we're not reliant on the market to build them out. A new division, similar to Telia and Division X, where in a large telco with many moving parts, and many of you will kind of have reference points to that, it's difficult to get stuff done. Let's cut out the difficulty and kind of have really sharp passes to move things on. Clinically directed with translation expertise, I have built out a team of world-class clinicians across all of the care spectrums, from population health, primary care, secondary care. I've loaded up chief operating officers and chief medical officers and chief nursing officers. So the issue of translation it doesn't hold us up. I have a good relationship base with the NHS. I think these are the ingredients for us to succeed. So to go back to your question, Amy, how can BT and other telcos support that? I think there are 4 broad areas for me, and I have to make things simple for me to understand them, right? Infrastructure, connectivity. So I did a survey with Ipsos Mori. 100+ organizations submitted their responses. Prizes for anybody who can guess the percentage of senior leaders, C-level leaders, who said that connectivity was a key issue for them. No, bit lower. About 71%, yeah? 43% recognize that there's been a major step change. So it ties in with your 4% figure, 4-year figure in terms of acceleration. But 43% said that there's been a step change, but we haven't necessarily got the skill set within the NHS, and telco doesn't really have the skill set to understand our problems. Yeah, key issues. Moving closer to home. So this is really, it sounds really good, this. IoT, my watch will tell you what's happening, doctor. Do you think the doctor's not got enough with running 3 AMU, acute medical wards, or the GP surgery is not full? How much more can they take? So the art is the contextualized data. Contextualized data based on clinical risk parameters and clinical judgment in real time, and we're building a platform for that to address the issue of anticipatory care. The piece around co-creation, everything that we are doing is not a BT play in terms of, I've got something, it's the best thing since sliced bread, would you like one? How about, I know about your operational issues in terms of your elective waiting list, I want to understand more. What can we do in terms of our leverage of understanding of AI to help you? That's one example, but all of our propositions are built out on that very, very structured premise of customer-led, understanding the needs and building our expertise into that process. And unleashing the power of data. So interoperability and integration is an issue. Telcos have a massive role to play with that as kind of platform aggregators. And we're doing something about that. So I've talked very generally today, and it wasn't my intention to go through much detail. I hope to answer any more questions. But what I want to say to telco folk is try to understand before being understood. And there is a huge amount of expertise in the NHS. Our doctors and nurses, for me, are the finest on the planet. If we use their abilities and free them up, then amazing things can happen. Thank you.
Thank you very much. And that was great. And I think that, gave us lots to whet our appetite. So we're all looking forward to sessions 2 and 3 to hear some more. But without further ado, I'd like to introduce Simon Huckley, who is going to talk about that last point that you brought up, Sultan. So very well timed about unleashing the power of data and, what is involved in enabling a healthcare system to integrate all of its data and bring it out to enable all of the use cases we're talking about. So Simon, please.
Yes, good morning to you all. I'm not sure if you can see me as well or only my slides, but I'm here working at home and unfortunately not in London, but thank you for having me. Today I will tell you something more about the data exchange we're building in the Netherlands for healthcare. My role as VP Health Strategy for KPN Health is a specific growth unit in B2B, committed for a couple of years right now to help the sector in the digitization agenda. I'm happy to tell you more about this data exchange, which the previous speaker already mentioned. And as KPN, that's what I wanted to start with. We believe in the power of connection. We believe that good connections will help people move forward, and as of that, move the Netherlands forward to a sustainable future. I won't have to explain that we have a lot of infrastructure and invest yearly over $1 billion in that infrastructure to keep it all accessible, from fiber to mobile, 5G, cloud, Internet of Things. And we want our network to be available everywhere in the Netherlands. So we have the top performance on that, on the, sorry for my English, forgot one word. And we want to contribute to the transformation in the Netherlands. And that's what we do for different topics, different sectors. And the healthcare sector is the one that is has I think the most focus and stable focus for the last couple of 10, 15 years. And what we do is every day we look at what this new role can be for our technology. How can we contribute to social themes of today, but also of tomorrow? And what we do with my team is to work closely together with healthcare institutions in the Netherlands, of course, on innovations that accelerate the digitization. And that's also how we work as a team, is a kind of a supportive role. We want to talk about the business first to understand what the sector is in need for, and then we talk about technology, knowing, of course, what our networks and technology and that of our partners can bring, but start with the business in mind first. And that's important, and I think that's not special for the Netherlands, but what we see in our country is that there's really an urgent need for digitization. With an exponential growth in costs, over 110 billion a year, increased demands for care, both in numbers, but also in specialism, and we have a shortage of skilled labor, and that's not only in IT, as you all know, but also in healthcare skilled personnel. That's really under pressure. And we cannot solve that in the old way. So we need new means to break that, to get it to breakthrough. And that's what our mission is. We want to keep together healthcare accessible, both digital. So it's not only digitalization, but it's also personal. We want to be able for everyone to have the personal contact, personal care, if needed. And to realize that we need to digitize what's possible. What do we bring? Well, as Amy we're kind to introduce, we bring services for over 10 years now with a B2B health vertical. We are fully committed to contribute to the health, but through our infrastructure, through our solutions. And what we deliver as a team, we work based on our solid horizontal propositions, of which I showed below. It's in Dutch, but it's KPN1, and it's smart combinations on the right. And on top of that, I built fully integrated vertical solutions. The one below is the eZorg, electronic health. It's a network infrastructure that facilitates the general practitioners and laboratories, for example, with safe connectivity. On the left, you have Zorgvrij. That's a domotic solutions, is a platform that make interoperability possible through different domotic players, and of course the communication and network services we facilitate for institutions. Then you have the CAM workspace. That's a specific workspace solution on top of Modern Workplace by Microsoft, for example, but with an intimate solution for healthcare, knowing what the processes and based on specific pure use cases. And then on the right, that's what I will talk about today, is the KPN Health Exchange. This is a new one, and we started a discussion about data exchange long ago. Artificial intelligence is a promise for the sector, as we saw today as well. But to do that, we need interoperability of data through all the healthcare chain. And what we discussed about is now going to be practice. So we have the first customers will be on board on the platform, and I'll talk about the KPN Health Exchange with you today to make safe and easy data sharing in the Dutch healthcare chain possible. What is happening today is that we live in an era where quality of life and well-being is not just the absence of disease or illness. It's more than that. It's strongly linked to our definition and quality of life. And we expect as a consumer a lot from care, from the care process, because in our personal life, it's becoming more and more digital. Themes like the quantified self, continuous measuring through consumer apps, that's the reality of today. And even if your health is a little bit less, you still want that this definition for yourself of what's important in your life and how you measure that to be included in the care process, which is not. It's even worse. If you look at all the different professionals in the chain, they are not able to share data with each other. It's all siloed. The data from your personal environment is siloed in different e-health apps or in your on other things, but it's also siloed within the medical chain, in the medical process. And that's what we want to try to fix. And we want to create, together with the sector, a healthcare system that's continuous learning. And we want to deliver the basic infrastructure for that. I'm not a professional in healthcare. I'm a historian, by the way, and my team is neither. But what we are good in is we have good knowledge about infrastructure, about technology, and we want to facilitate this learning healthcare system in which data is interoperable, fully interoperable. And it can flow freely to where the data is needed, where information is needed, and where it is allowed. Yes? And sometimes it's not allowed. You have personal data that you don't want to share. And for example, with consumer e-health apps. But in times of a crisis, it's very useful if my sports app will send data to the general practitioner who knows what I did last week and that something changed in my behavior or changed in the way my body reflects on my behavior. So in short, it's reuse of information that's necessary to improve care and to keep it personal and affordable for everyone. Then how to deal with the complexity of this data-driven healthcare. And why is it so complex? Well, the time is too short to explain, but I think a lot of you will understand and know it's due to legislation, compliance, data sovereignty, data quality, and data security. On the personal side of the individual, but also on the institution side, it's complex. And second, the complexity of the healthcare sector itself doesn't make it easy to create a common understanding of how to get to a breakthrough. Therefore, I think, and what I observed, the two things are needed, and I think to be set by a government, and that's what happened in the Netherlands. And one is a data framework. So for hospitals to share patient information and to share hospital information to the patient, to get interoperability of this electronic medical records or health records, we have a framework called MedMij. And in that, the building blocks of how we translate data from a siloed application to a common understanding for everyone, that's written down in that framework. So that's very important, and that's created by the sector itself, and that's for us to build our IT towards. I don't know if that English is good enough, but I hope you understand. The second thing is nothing changes without comfort, about ease. You need to be feeling safe in your business model in the current way you are acting before you can change. And that what's happening here is we have the VIPP program, which creates the funding and the means to change for institutions. And the last thing, the third thing that I didn't mention is that it's imposed. We have deadlines to create this interoperability and to be operational for the first steps in 2022. So there's momentum now in the market as well. Then every institution needs to be ready, and they need to deliver the data according to this framework. And why is KPN involved in that? Well, we are IT partner for a lot of these healthcare institutions, and as a telco, we are also used to do nationwide investments and scale. We used to scale, like I presented in one of the first slides. And what we can do is make reuse of this generic infrastructure possible and reduce total cost of ownership for a separate institution, a hospital, for example, to step into this new framework. And this framework and our solution is also a stepping stone to accelerate new business models, the adoption of new technologies, adoption of continuous monitoring from the cure process towards home, to bring it close to the consumer, and all upon a safe and stable data infrastructure. So, sorry, I missed one slide. Isn't it? No, I'll continue because something went wrong. But the question I often get, and that's maybe for today is very relevant, is are telcos like KPN fit for this purpose? And our answer is, of course, yes, otherwise I wouldn't be here. And And it's not only because it's in our mission, it's in our DNA to work together with the Dutch healthcare sector on this digital transformation, but it's also, sorry, need to go back. It's also because what we bring are three things which are crucial for this transformation. One is our networks. We have connectivity securely to an ecosystem of not only healthcare institutions, also partners, e-health partners, for example, and it's also an informal network. We are there for a lot of years, 150 years in the Netherlands, and over 10 years in healthcare. So the relationships are stable, which we have trust in the sector as well. So it's in networks, in data infrastructure, but also in personal networks. The second one is being a telecom provider. That's very relevant for this change, because we know how to keep data safe and protected. And the governance places also a high demand on us as a telecom provider regarding data and privacy. And this is a change for the sector, which is, for some professionals, very scary, because the data you normally wrote down in a file and now is stored in an application will be accessible to everyone. Well, how can you do that with a consent of the owner of the data, which is safe and it's fully compliant with privacy, for example? But that's something we do every day for everything, every communication we facilitate. And the last thing is we are used to provide IT as a service. So we are used to invest in services that are available for everyone and delivering it through stable platforms. And I think stability for this change is crucial. You want to we're going to be dependent on this data exchange, so it must be available at all times. It was a very short introduction. That's what I realized, and I couldn't elaborate on everything, but I hope I gave you a short introduction to this proposition. And of course, we're happy to talk to you about that in more details afterwards or later on in the Q&A. Thank you.
Great. Thank you very much, Simon. So I'm going to please call Sultan back up to the stage with me so we can have a bit of a panel discussion with the folks who gave us their presentations and with Sultan. I hope we're going to get those who presented on stage on video. They're coming up. Fab. Just the two of us. Oh. Hi, everyone. So nice to see all your faces since we missed some of you during the presentations. But thank you so much for everyone for joining us today. And I think you guys have done a great job of showcasing really the range of stuff that telecoms operators are doing, commitment to try and really drive some real change in the industry. So I'm going to ask a few questions and then we'll open up to the audience because I'm sure you guys have some too. So I'm going to dial all the way back to the beginning of our conversation. Let's hear from Christopher and Jürgen again. So I'm curious to know, obviously, what you guys developed around COVID-19 and predicting patients is really interesting. And I have two questions around that. So the first one is, where does this go next? What else can you do with telecom data that will be relevant for the healthcare industry? And how transposable is this into other markets? Can you speak to Sultan and help him do this? How long will that take to transfer over to the UK? So maybe question one first for you, Christopher.
All right, thank you. A very good question. I'm new to the healthcare space, so it's been especially rewarding to learn how we could be useful also here. I do think we've scratched the surface, and I think there will be a lot more applications, certainly. Human mobility is about who we are. It's about how we interact in the physical world, but it's also how diseases spread, and hospitals are for physical beings. So I think mobility should be used and can be used a lot more for various types of use cases. And for this particular case with how, what's the next step? And we would love to see this, of course, being used by many, many more. So the way we help with that at Telia is to take and productify things and make it available on the shelf. I think we're not fully there yet with this solution, but that's also how you would make this actually transportable to other markets as well. But it was really the Ericsson team where, our data is in our footprint. Colleagues like KPN, BT have that data for other markets, but it's really, I think, the brainpower in Jürgen's team that actually transformed this into real insight. So handing over to you, Jürgen, to elaborate on that.
Sure, thanks, Christopher. Yeah, so the technology could definitely be reused. Of course, some kind of adaptation would be needed because it was, when it comes down to detail, it's a certain sort of parameters and properties of a data set. But I'm absolutely sure that something similar could be done in UK or in other parts of the world. So yes, absolutely. Even though it's the same for us, it's not something we can take off the shelf and just sell or share, but it would be possible, yes.
I mean, just to probe you a little bit more on that, what kind of technology readiness does an operator have to have in order to implement this, and what's your time frame? Okay, you have an algorithm that you've developed in Sweden. How does it take 1 week, 4 weeks, 6 months to tailor that to a new market? I know I'm pressing you, but just a little bit.
Yeah, you're welcome to do that. I would say it would take something from, depending on the setup. If it would be identical to what we have run in Sweden, I would say that it would take a couple of weeks, something to do sort of a trial in the same sort of semi-manual way when we use data scientists. If we want to fully automate and get this into production, I would say we're talking about months, something like that.
Okay, great. There you go,
and that
guys.
assumes, of course, already that the data exists from the telco. For us,
Absolutely.
it has been a big investment and effort to actually produce this underlying privacy, secured official statistic type of data that underpins you can't do any AI if you don't have the data. So that takes more than a few weeks or even a few months. That's actually a big endeavor for a telco to actually make this available in a productized fashion.
Yeah, of course. I think
Absolutely.
that there's a telco
Fully
readiness first. So Simon, obviously with the data exchange that you were sharing with us in the Netherlands, you're sort of playing a layer below this application where you're sort of, the aim is to aggregate the data and make it available for these types of applications. Is that right? Am I understanding that correctly?
Yeah, that's correct.
And are you enabling anything like this yet? Sort of how far along are you in this journey of getting a functional up and running data exchange that could enable something advanced?
There are different roads towards this dream. Of course, we all want to use artificial intelligence more and more in the current processes. What we started a couple of years ago is a data services hub, which is actually running on real-time data and create with AI partners new insights. That's one road, but what the complexity in the healthcare sector is, at least in the Netherlands, is that all this crucial data that you want to use for AI is enclosed in different silos. And the first step is to open up these silos and open up the data in these applications in a common language. And as soon as we have laid down this basic infrastructure, this basis data exchange, then we can start using all the different tools to get new insights and new information out of that. So it takes, I think, 1 or 2 years to get this fundament fully operational for the Netherlands. And in the meantime, we're already working with research institutions to create the first steps and first insights. So it's a parallel transition.
So Sultan, what's your feeling in terms of the comparison between your European peers and what's happening in the UK in terms of getting this data available and developing the kinds of solutions that Telia is bringing to market? I think it'll go on automatically. Can we have Sultan's mic on, please? I think they do.
So,
There you go.
Okay, I think there's probably 2 or 3 sides to this kind of particular problem. So I think my colleagues are absolutely right. So the data availability is there with the telco. So we could kind of capture that data through our networks. Okay. The issue we've got in England particularly, as you know, the kind of data strategy is kind of being looked at. Last week, we've had the upheaval of NHSD and X, kind of our regulatory bodies coming together. Then there's the Information Commissioner's Office, and there's a whole lot of, if you like, information governance required to kind of do this. But in terms of the principles, they absolutely apply. So this is about making kind of clinical intervention or a system intervention to prevent something or kind of to improve something. We've had it before. So within the hospital space, for example, RFID technology, certainly in America, is used to kind of monitor assets, patients, etc. So there's no difference in principle in terms of using mobile technology, combining it with kind of in-house RFID technology, synthesizing the two, developing your algorithms. I think telco can, we have a lot to learn from each other clearly. We can probably do that quite quickly, The issue you've got is kind of where does the data sit, the ownership control, etc. of the data, and the permissions reliable, primary usage, secondary usage, anonymization, pseudonymization. We have colleagues from kind of data companies there. Sensine Health are here, right? We've talked about this for years. So the principles are sound and the applications are really real. So I'll give you one. So we had similar technology. This is during my NHS days. And because we can track movement of people and assets through our kind of hospital estate, we could actually map back to a series of untoward events and work out the, if you like, the precedent events that led to that. So there is kind of systemic learning and a kind of safety benefit as well. So I think the telcos are ready. The other side also needs to get ready, and we need to kind of work together. But I think there's a co-creation piece here. I think to differing degrees, and I can't reveal any more because of practical reasons, we're into all of these 3 areas quite actively.
Oh, right. Okay. Well, I was going to press you more, but you've already anticipated my question. So I want to, get from all of you guys a sense of, what do you think has been your biggest challenge of trying to bring digital solutions into the healthcare space? What has been the biggest challenge you've faced, and what did you do to overcome it? So I know, Christopher, you're new, so maybe you're coming at this with a fresh pair of eyes.
Well, I think it's quite similar to what we see in bringing this type of data and insights into other industries. It is the maturity of digitalization. It's hard to be data-driven or accept the data-driven approach where someone comes with a product or an insight if you're not working like that, if you're not willing to change your way of working and change your processes around that. And for me, coming in with fresh eyes or tired eyes from the other industries, then I see it's quite similar. Data exists in silos. Digitalization is a key enabler. And we as telcos can actually provide a data set that we have curated, that we're ready to provide. That can be a way to unlock and not wait for unlocking your own silos. But it does require that you are ready to do that digitalization journey and be ready to be data-driven.
Jorgen, anything to add from your experience?
No, I would say sort of experience from our COVID-19 project is that the collaboration is really key. So that's the way of overcome challenges, that we need to work together. This project we run, it wouldn't have been possible without being the 3 parties. We wouldn't been able to do that, Ericsson and Telia together. Well, we could have guessed doing something, but then we wouldn't know if it would have been really useful for the healthcare. But now, since it was a 3-party collaboration, it actually worked out very well. So I think that's an important aspect.
Yeah, I think, I've heard this all yesterday and today. All of this co-creation is really sort of the key in making sure that you're starting with the same idea on, you understand that you're working towards a collective goal. Simon, from your experience, sort of what's been the toughest challenge in developing the data exchange so far?
Well, I recognize the same things as mentioned. So it's collaboration. It's also about being mature in your digitalization, because that will create data instead of that. As soon as it's there and we are able to use it, then we can learn from it and adopt. But maybe to add to the first 2 points is that what we also see is that we come from a world where telcos created, and we did it ourselves, a kind of a POC paradise, a proof of concept paradise. We bring the technology and experiment with it, and that's useful to learn. But now we're in times that we don't have time to facilitate and to wait for all the results. So we have to build on each other's shoulder and then move on. And I think it has to do with culture, with mindset, with willingness to work together. And I think momentum for that is right there. So if I talk with the healthcare sector and the professionals, we are really waiting for the telco to tell them what's possible and advise them how, and let them fill in how the processes can be digitized and where to start, and then move together, build on each other initiatives instead of doing it all by ourselves.
Yeah, I think that's really good, that proof of concept paradise. I'm going to remember that one. Sultan, what's your perspective from being on both sides of the fence?
The perspective is very similar to my colleagues. I think the first thing to say is context. So we are kind of on the back end of a pandemic and something else is coming on. And it's been 24 months where my NHS colleagues are running on fumes. And I think that's probably the same for all the other health systems, kind of certainly in kind of the developed world. So the bandwidth that doctors and nurses has is limited. The organizations are firefighting, and it's kind of tried to make it to Friday. Yeah. So that's the context. But in that is opportunity, because some of the processes that we have within the NHS and in other systems, they really required looking at. And I think just to my last colleague's statement around, I think, you know, we need to develop infrastructure. Absolutely. We need to kind of seize the opportunity of COVID. But the storytelling around what is in the art of the possible is really important. So we kind of overlay AI data over a kind of suite of data points. What is the impact going to be on outcomes? If we can make that link very clearly and kind of show some evidence, then there is a real level of buy-in. And if we pick the right organization, so the culture and leadership is really important. So the NHS is kind of not one organization, it's a constellation, right? And there is a normal distribution. And it's not always the most obvious places where you'll get the most benefit for your investment and partnership buck. So thinking about who your partner is, what the culture is. I'll tell you a good indicator though. The NHS does a staff survey every year. And the organizations in the top right-hand quadrant tend to be the most innovative, safe, effective, caring, well-led and responsive. So if you pick where the kind of, if you like, the base metal is there to kind of work on, you won't be too far wrong. I think as telcos, my real sense is telcos have a real willingness, certainly in the UK and what I can see in Europe, to do this. And it requires a level of collaboration, but we've got to try, perhaps fail fast, iterate and keep going. That's my two penneth.
Thank you. So I think we've got time for a question from the audience. Does anyone want to put anything to the panelists? Don't all raise your hands at once. Yeah, please go ahead. Mike is coming.
Julian Bradwell from Sensign Health. We've talked a lot about collaboration and co-creation. But we've got 4 global powerhouses on the stage. I just wondered where small, medium enterprises fit into that space, or does it just stick with you and the healthcare systems? Bit of a loaded question.
Does anyone want to take that?
I can start. I think small, medium enterprises, startups, scale-ups play a hugely important role going forward. I think we see this, at least in other industries, where these smaller, medium enterprises are fast, especially in the world of AI, coming up, solving very narrow use cases very well. But they don't have always the ability to scale that quickly into the industries and get quick customer uptake. We, as bigger players, typically have a large customer base already. We can do a lot more to enable that. And that is something we in Telia Division X are working heavily on, is actually leveraging that and not do everything ourselves, but use that innovation, that speed that's coming from these small, medium enterprises, and do what we can to scale that into our footprint.
Any more to add?
Yeah, I'd just to back up what my colleague says, so this is, Julian, around complementarity. So your suite of products, your very, very clever AI suite, there is absolute read across into kind of the health service. But as we've said, what we can do in terms of Teleco, we can lay the infrastructure for you, but also support you in kind of scaling up. So I think if the way health services are going across the planet, and if digitization is going to be the big thing, which it is, it's about digital deep data ecosystems. Yeah, and ecosystems by their very nature require complementarity in its full sense, and a multiplicity of providers. Some of the biggest innovations we've seen in the UK health market have come from SMEs. So I think they are vitally important, because the agility, but also the way to solve problems is by kind of moving very quickly, and you have that, I think, ahead of us. So let's work together.
Great. Well, I'm aware that we've got another session coming up. So I would like to thank our panelists all very much. Thank you so much for sharing with us what you've been doing in healthcare. It's been really enlightening to hear what you're doing, and looking forward to seeing how it evolves next year. Thank you very much. Round of applause for our panelists.
So much.
And so I will now hand over to my colleague, Darius.
Perfect. Thanks, Amy. So I'm Darius. I'm one of Amy's colleagues at STL Partners, and I'd like to invite Gus onto the stage, who will be joining us from Deloitte. And hopefully on the big screen, we'll get Danny Kelly from Vodafone as well. So what we'll want to talk about in this kind of panel session is a bit more about how telcos can use partnerships to kind of scale their healthcare businesses, but also help the healthcare industry transform. So do we have Danny coming shortly? Brilliant. Well, I don't know if while we're waiting for Danny, Gus, if you want to give a quick introduction to yourself.
Yeah, sure. Thank you very much. So I'm Gus Meyer. I lead the UK healthcare practice for Deloitte, mainly in our sort of technology divisions. My background is doing operational improvement. So really working with hospitals to transform their services, working with clinicians, nurses, day in, day out for the last 30 years. And in actual fact, Sultan used to be one of my clients when he was in the NHS, solving some of his difficult problems as well.
Brilliant. And I guess while we're still waiting for Danny, I don't know, the first thing, I guess, was a bit about the context between the partnership between Vodafone and Deloitte and what it really means for the industry. So I don't know if you could give your view on what are the overall kind of objectives, what's the vision for this strategic alliance between the two of you?
I suppose it starts with the actual problem that we face here in terms of healthcare. There are some what I would call wicked problems out there, increasing waiting lists, lack of access to physicians and hospitals, workforce agenda, and increasingly an aging population whereby people are living more and more at home with comorbidities. Could they lead a better quality life, and can we actually help them to do that? So those are some of the sort of problems that we're really interested in solving through, Deloitte has a history of working with other organizations, and strategically these days, there are so many difficult issues and complexities to solve that actually you can only do by working in partnership. And that partnership is not one-to-one, it's actually one-to-many. So that's the sort of way we see our sort of working model going forward. So we'd like to work with a number of organizations to solve some of those problems.
That makes sense. And so what do you feel the role of Deloitte is in this partnership versus Vodafone, for example? And as you do look to scale and grow the ecosystem and bring in more and more parties, how might that role evolve?
Well, if I look at Vodafone and what they bring great connectivity. They have a huge range of leading edge. Hi, Danny, how are you?
Yeah, very good, Gus. Just I'm listening in the background. You boasting about Vodafone. Keep going.
I'll carry on, Danny. But Vodafone bring fabulous sort of connectivity and have amazing sort of technology. And in particular, what they're able to do is look at a particular problem and come up with innovative solutions. So from that point of view, I'm really excited to work with Vodafone and Danny in particular. But Danny could tell you a little bit more about Vodafone and their sort of solutions. From our perspective, we have a huge history. Myself and my team have over 30 years worth of health experience. We bring great transformation skills. We have clinicians, nurses, doctors, general management, ex-directors of finances, all on our team. So we really bring that ethos of understanding the healthcare practices, but we have a huge desire to try and help. And that's the sort of exciting thing that we can do here is actually between the two of us, we believe by creating a fabulous ecosystem that we can help solve some of these really difficult problems going forward. Danny, I don't know if you want to add more.
Yeah, I mean, Gus, you're spot on here. I think actually what we're seeing now effectively is the need for collaboration in the ecosystem. If we're really going to begin to transform healthcare, it's incumbent upon us to actually collaborate together, work together, and recognize the need that actually not any one party has all of the answers. And therefore...
Oh, sorry, guys, I think we've swapped the... Okay, technical difficulties. So I think we'll go back to you then, Gus. So one of the things that we're quite interested in as STL partners, because obviously we work in the telecom sector, is what is the strength of the telco to do some of this? What is the credibility for them to actually start to transform? And you mentioned, of course, the connectivity and the technology skills, but where does their credibility come from to actually make a play within healthcare versus other verticals, or to take more of a role within what they're traditionally doing in just kind of consumer or enterprise connectivity?
Yeah, well, I think people forget that Vodafone have been operating in this sector for quite some time and have huge coverage within the sector. And in particular, the clients that we've sort of surveyed and talked to have a high regard for Vodafone. So that's fundamental. So they're already operating in the market. So it's not that they're coming to this market in a new way. I think what we're trying to do is actually come in a way that we've got some creative solutions and looking at the sort of things that we're looking at key problems when we come to market is how do we solve a particular problem? I don't know if you, Danny, if you wanted to sort of elaborate a little bit more.
Yeah, absolutely. Look, there's a lot that we can do today by way of core connectivity. And I think one of your guests before, Sultan, was on the stage and he talked about the need for co-creation, collaboration, understanding the problem statement. I think that's key to what we're trying to do now. It's about not taking a product to market and trying to wedge it in, square peg, round hole. It's about doing the insight, the research, working together to understand those challenges, and then stepping back from that and recognizing the need for development to the specific problem statement. And then effectively we can build solutions that actually matter and we can deliver positive outcomes. And I think that's where we need to get to. It's about creating, clinical and patient outcomes that are desired. But of course, before we even get to that, there's other challenges that we can fix immediately. So it's not all about jam tomorrow. It's not about what we can do in terms of research and insights that allow us to deliver a solution for tomorrow. There's a lot we can do today. Again, Sultan mentioned some stats with regards to a recognition that core connectivity is a major challenge. I think it was in excess of 70%. And that is true of any hospital that we talk to. Connectivity is a challenge simply by the nature of their buildings. And therefore, how do we address those challenges? Because it's very difficult for us to go in and have a conversation around reimagining the elective care pathways for surgery when actually we still can't make a phone call in certain parts of the hospital. So let's deal with core connectivity issues. Let's get that resolved. And once we fix core connectivity, the rest can come because we can build on top of that like a layer cake applications that can begin to really transform different areas by way of the capability. And this is no different to what we're seeing in the private sector. We're just faced with very different challenges in the healthcare sector, and therefore, and by the way, a very different need as a result of the pandemic. And therefore, it's great to hear your other presenters today talk about that focused effort that we're all going to lean in together. And I just get cut off there, not due to connectivity. I will say somebody else bounced me off the platform, but I just get cut off when I was making the point about the ecosystem, the need to collaborate, and that's a fact. And I think that's the maturing of the industry when we recognise it's not no one party has all the answers. We can't simply build a product and bring it to market. So Vodafone absolutely needs the expertise that Deloitte can bring us by way of that research, in terms of understanding the needs. And also, by the way, the implementation of that change management. So it's great to have a great capability, but what if it's not adopted fully? You can't realise those benefits. So there's certainly a need for Vodafone to work alongside partners like Deloitte, but also the application providers. We will not bring all of the applications that can leverage our new network capability. So 5G will bring capabilities around speed, bandwidth, capacity, and everything else. We've got edge computing, we've got IoT. You can bring all of that together, but the reality is it's proximity to the problem statement, and those partners who develop applications that recognize and understand the problem statement, those are who we need to work with. So if they can leverage the network asset and work collaboratively with ourselves, with Deloitte, and others in the market, because there's enough for us all to work towards, then effectively that's what we need to do. So from my perspective, this collaboration with Deloitte, and I can see this happening across the industry, it's a maturing in the industry as we recognize the need for this powerful ecosystem.
And if I may, I think just to probably draw to attention what Daddy mentioned about focus, it's not one size fits all. And that's an important point to sort of recognize. It's actually you have to look at the particular problem, actually solve that particular problem, and then move to your sort of next client, and actually their problems might be slightly different. And that's the sort of take-up aspects that's going to be very, very important. And I think that's the collaboration between the two organizations, but importantly, the ecosystem partners that we develop and work with over the next few years.
And that's quite a bit about, I guess, solving the customer problem. How is this partnership kind of solving the problems for the telco, I guess, in driving forward innovation and overcoming some of the challenges like some of the previous telecoms operators mentioned around bureaucracy or some of the legacy mindset, some of the legacy infrastructure? So how is this helping Vodafone, I suppose, overcome some of those internal barriers? And even the move towards ecosystems is quite new for operators, and the move towards a platform model. So, how does this partnership help you do that and overcome some of those internal barriers?
Yeah, good question. There's no doubt it's a great catalyst. I would say this from Vodafone in particular, we are a business that's driven by purpose. So we're very focused on purpose, and it's in our DNA. So what do I mean by that? It's leveraging our connectivity for good. So how can we take what we have as a core capability and actually begin to make a meaningful change? No one wants to go to bed every morning to sell another mobile device. That's not what we're here for. But if we can actually make a meaningful change into healthcare, and addressing challenges in this industry, then that's a reason to believe. And therefore, we're very focused and passionate about that. So for me, this opportunity to collaborate with Deloitte in the healthcare space is a great catalyst to effectively drive that innovation agenda. Now, of course, from a technology perspective, over the past 5 years, we've seen a massive leap forward. We've moved from 4G networks to 5G networks. Our IoT capabilities have expanded. We're moving into the edge. And as a result, there's lots of different things that can hang off the back of that. So there's a requirement for industry to change, and in particular telcos to change in terms of where they bring their services to market, how they're consumed, the platforms that we offer those on. So there's a massive focus now shifting towards our innovation agenda, and it's driven by the technology requirement, yes, within our customers, in particular in healthcare, but actually the technology change within our own business. We have just had a seismic shift change in terms of what we can bring to market and how we can become a key enabler of transformation in every industry, but fortunately for us, what we can do within the healthcare industry.
And Gus, I don't know if you foresee, well, if you had anything to add, but also if you foresee any challenges kind of trying to navigate some of the internal telco issues with this partnership.
Yeah, I think there's a couple of things I'd just point out. Firstly, the pandemic has accelerated things to such an extent that, I think your survey said it's moved the market up by about 4 years. My personal belief is that it's about 10 years in working in the sector I do. So if you look at technology adoption, so it's really accelerated it. And I think the need for it in particular is here. You've got some, as I said, some wicked problems in terms of aging population, but more importantly, people expect high healthcare requirements, high healthcare outcomes. So the expectation is pretty huge. And actually, I do think technology is the way to deliver that going forward. The whole broad range of healthcare. And importantly, people also want to look after themselves. And actually, the way you do that is increasingly through the use of technology. So I think those platforms are there. Importantly, again, the adoptions from the patient side, but also from the client side is there as well. They want to adopt technology. They want to have a better work-life balance. Actually, so you've got both of those particular aspects. I think in terms of these sort of navigations, in terms of understanding telco, it's very new to me. I am a healthcare expert, and that's what I've been doing for a long time. But Danny has made it very simple for me. Working together, I think it's going to be a long-term sort of partnership where both organizations understand each other. We have a long history of working with Vodafone. And probably coming back to your original question, I think both organizations have been working in the healthcare sector for quite some time, but we navigate at different sort of levels. And actually bringing those two levels in terms of understanding individuals, policymakers, organizations at board level, and also from a technical point of view, actually you've got a better holistic system to address some of the issues.
Brilliant. And I think my last question before we maybe hand over to the audience is, we're talking about building ecosystems and partnerships. I think it would be a bit remiss if we don't talk a bit about the hyperscalers and how they build ecosystems around this and where they may fit into your own ecosystem as well. So I don't know, Danny, if you had any views on that.
I think that's yet to be seen. Without doubt, we can't dismiss the sheer level of investment that the hyperscalers can bring to delivering positive outcomes, and that's what we're here for. It's about delivering positive outcomes. It's not about it's not about capital gain. It's not about privatization. It's how can we effectively bring connectivity for good. So if we can leverage that hyperscaler investment in an application layer that layers across the top of our core connectivity, then we've got a win-win. Now we haven't seen what those are yet, and we'll have a look at those certainly within the development of our ecosystem. But it's not just about working with the hyperscalers, because as I say, it's proximity to the problem statement. So actually you might actually find that it's a very small organization who is very close to the problem statement, who's developed that killer application that will really make a difference. So everything is up for grabs at the minute in terms of us understanding how we can leverage the benefits. But of course, as I said before, there's a lot we can do even before we get to that point by way of core connectivity and what we can bring today. So we're super keen to work with anyone who can support transformative solutions that is insight-led and insight-driven. So we have to work with the data, we have to work with our partners in the healthcare space, we need to understand those problem statements, and if the end point of that is a application or a solution that may have been built by a hyperscaler, then certainly happy to work with them.
Brilliant. And
yeah, just to sort of reiterate, it's coming back to what is the problem, and then and I think we've heard other sort of presenters talk about, is co-designing that solution. Now, I think when we talk about co-designing a solution, there's a big spectrum to actually looking at the solution, solving it yourself, or working with an ecosystem. Our preference is to work to the other side. We believe there are many, many organizations out there who actually have the solution to the problem. It's marrying those two up, but we're really keen to sort of bring the leading edge technologies together with great connectivity and transformation skills on the ground and really making the change on the ground.
Brilliant. And I don't know, I think, do we have some time for questions I don't know if anyone had any questions for Danny and Gus about the partnership or how they're looking to transform and build out this ecosystem? No? Brilliant. In which case, we'll leave it there and let you guys go. So Danny, thanks a lot for joining from Ireland. And
thanks, Darius.
Hopefully speak to you guys soon.
Thanks very much. Cheers, Danny.
Cheers, Gus.